afternoon, and welcome to Mercy Health's Healthcare Spotlight. Every Saturday, Mercy Health brings you important and helpful information that we hope will help you in your personal and family healthcare decisions. Mercy Health Muskegon offers the best of both worlds: quality, local healthcare, and access to specialists, technology, and cutting-edge treatments throughout the region. Whether you receive care at our hospital or one of our system locations, we are committed to helping you receive the very best health care possible. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. Well, good afternoon. I'm your host, Michael Z., and today we welcome Carrie Kelly, Operations Supervisor of Mercy Health's Weight Management, and Merle and Bob Scolnik, a couple who participated in Mercy Health's Weight Management HMR program. Today we will talk with all of them about Mercy Health's HMR weight loss program. So let's start with Carrie. And Carrie, what is HMR?
Great question. Well, HMR actually stands for Health Management Resources, and they are a national healthcare company located out of Boston, Massachusetts, specializing in weight loss programs. And so what they do is they partner with healthcare professionals across the country so that we can deliver local weight loss programs with within hospital systems. So that brings us here to Mercy Health in Muskegon, where we have one of those weight loss programs that we offer the community here.
So tell me about those kind of programs. What's available? What kind of programs are they?
So all of our weight loss programs are data-driven and physician-backed. They use the HMR meal replacement products, so those could be shakes, entrees, benefit bars, those kinds of things. And those products, they help reduce your calories that you're taking in by giving you a quality, tasty, delicious meal replacement that can replace a meal, usually a higher calorie food.
And tell me, this is a non-surgical weight loss program, correct?
Correct. It is a non-surgical program. So a lot of times people come to us and they don't know what to do, and they've tried lots of different things, and they're just looking for something that doesn't take a lot of guesswork. And so using our products, we put them on structured eating plans that use some of our products along with fruits and vegetables. We also encourage, physical activity, drinking water, just a lot of healthy behaviors. But our structured diet plans that we put them on really help them easily find a way to cut those calories and lose weight.
Yeah, so you kind of touched base there already on the ideal candidates for this program. Is it, they're not ages or sizes or any of that. It's really kind of, if it fits for you kind of program?
Yeah, I would definitely say that. This definitely isn't a program for children who have different needs. When they're overweight in their adolescence, there's some different factors that come into play with that. But adults of all different kinds, ages, genders, this is a good program, good program for them.
Okay, and joining us today are Bob and Merle Scolnik, and they've been part of your program, correct?
Yes, they have.
And how long ago Merle? How long ago did you start with the program?
Well, Bob started first, and he said to me, you can't do this. And I said, well, yes, I can. And I've tried a lot of different diets and have never been really very successful. But I wasn't going to let him say I couldn't do it.
Oh, a challenge. Challenge met.
So I started, I think it was around the summer, sometime this summer. But Bob was on the diet before I was, for about 3 or 4 months before me.
Okay.
And I really like it. I think there's a lot of good entrees that I like to eat, and they're easy. I haven't turned my burners on my stove for about 5 or 6 weeks. Bob just turned it on the other day because we aren't really doing much cooking anymore. So, and that makes it nice. We do have some problems, though, because we tend to eat out a lot because of the things that, the activities that Bob is involved in. So, but we've found a way to manage that also. So.
Well, yeah, and then Bob, you're a Muskegon County Commissioner, and a retired businessman and philanthropist. So you've been a pretty busy guy most all your life, obviously, and still are today. And I noticed that you really kind of started the program when you're a retiree almost, when most people aren't thinking of these type of programs. So I was pretty impressed by that. What brought you to the program? Why did you get started on it?
Well, the truth of the matter is, I got on the scale one day. Now, I already knew I weighed too much, but I'm short. I'm 5'4". I was really having a problem buying clothes. I was buying sizes that were so big, the clothes they fit my waist, but I looked like I was wearing some kind of a clown suit, and I wear neckties a lot. I wear suits and sport coats frequently. Well, in order to buy that, I found there were sizes that I had never heard of. Now, I always knew there was portly, but did you know there was a portly regal? And there were other sizes that were kind of oddly cut, so you sort of look like a squash or something. And it just got really annoying. So I get on the scale, I'm up to 200 pounds. And I know that for some people, 200 pounds isn't that much, but when you're 5'4", 200 pounds is quite a bit. Right. So I just decided at that point, I mean, I had made a half-hearted attempt to lose weight numerous times, but it never worked. My good friend, Bill Johansson, who is in the Muskegon Rotary Club with me, I know he had been on a weight loss program, and I challenged him. I said, and the club was on this healthy kick. 1 in 21 by 2021 we would be number one in the state in terms of health for the whole community. So I challenged him to a weight loss. He and I would get on the scale and then at Rotary and see about losing weight. Well, he didn't really want to do that, and he encouraged me to go over to the HMR weight loss program, which is located over at the Heart Center, part of Mercy Hospital on Sherman. So I did. He said, join me for a meeting. The meetings, I think, were at 5:30, the particular ones he went to, and I went, and I got hooked. I signed up. I started going every week. I actually liked it. The instructor was a lot of fun. We were there for maybe at the most an hour, 45 minutes, an hour. The food, you would think that the food, because it doesn't have to be refrigerated, basically you're buying entrees that you heat for 60 seconds, and there's a lot of different choices. You'd think, how good could that be? Well, it was delicious. The food was really good, and then I never was one to eat salads. I kind of got into that. Now I have Crohn's disease, so there's some salad items like lettuce that I can't eat. But there's plenty of other things. Tomatoes don't bother me. Cucumbers don't bother me. A lot of things don't bother me. So I kind of looked forward to the salad, entree, bang, done. Shakes. I look forward to the oatmeal. I was pretty much eating oatmeal every day, and I like it. I mean, it was like really good. So
yeah, who doesn't like oatmeal, right?
Well, you know what? I didn't eat oatmeal before.
Oh,
not much.
Yeah.
But I don't know. I still eat it. I had it today. So anyway, this just went on, and the weight started coming off, and I can't say I lost weight every week. I didn't. I don't think I ever went backwards, but some weeks you don't lose anything. Other weeks you lose a little, and some weeks you walk in and all of a sudden 3 pounds are off. I lost a total of 37.5 pounds, so I got down to about 164 pounds, which for me was pretty comfortable. And I am 72. I have 2 replacement knees. I mean, it's not like I'm not reasonably healthy. I am, but I'm not an athlete.
Right.
So you have to do. Really, exercise is important to some level. You can do without it, but I just started walking. I bought a Fitbit. I've walked close to 3,000 miles since I started.
Wow, 3,000 miles. That's you're almost to LA now, I think.
Yeah, it isn't. I mean, if you're doing 5 or 6 miles a day, which isn't hard to do if you keep track of it.
Right. It adds up.
It adds up. So
yeah, and for you, Merle, I understand that you were a little bit of a challenge from Bob, and then you kind of joined the program. And what did you think about the program, and how did it help you?
Well, I really, first of all, I want to say something about the classes, because the instructors that they have that work with you and give you ideas and suggestions and for snacking and for doing different things are really wonderful. And I have a really wonderful instructor, and yesterday I was the only one that was there. Everybody was on vacation. There were 3 or 4 people on vacation. And she sat down with me, and we spent a lot of time talking about snacks and so forth, because that's a downfall for me. And first of all, I know I can't have it in the house, but if there is something in the house now, I'm able to stay away from it pretty much. He's not so much. He has to have the sweets out of the house.
Oh, you've been found out, Bob.
Yeah, or he eats it. But I have lost, as of yesterday, 27.5 pounds.
All right.
And I had a little bit of a problem because I had a cast on my foot or leg for 7 weeks, and there really wasn't much exercise that I could do. But I did as much as I could. I go to Tanglewood, and they have some classes in the chair, which I was able to do with my problem. But I have a Fitbit waiting for me if my husband will ever set it up. But anyhow, no, I've been very pleased with the program. I've been on many diets, and I've been to one program umpteen times. In fact, I got another card about coming in and for not having to pay the initial fees and so forth. But this program is very simple to follow, and I like the fact that I sit down and I put my food in front of me, and well, first of all, it only takes a minute to cook, and that's very simple. And I eat vegetables along with it, and it really seems to satisfy me. There also are milkshakes, which I have found has helped me when we're going out, because when I have a shake, it fills my stomach, and then I don't really eat as much when I go out. So that's been helpful.
Now, Carrie, Merle and Bob both brought up a number of aspects of the program here, in particular the food. But Merle hit on something that's very important is the classes and the counseling. I think is that's a really important aspect of the program, isn't it?
Oh, it definitely is. I mean, I think that we all know what to do, but the ability to actually follow through and do it is probably the challenge for everyone. So I think the structure and accountability that we offer by having people come to classes is probably one of the most important things that we can do for people.
So to walk me through that initial phase of, okay, I've made the decision to come down to Mercy Health's Heart Center and join the HMR program. Take me through the first initial phase of this program.
Sure. It's pretty easy, actually. All you do is you give us a phone call and tell us that you're interested or that you're looking to see what our options are. And you come in for a free information session. So at that session, we go over, what the programs are that we offer, what the cost is, give you some samples of the food to try, and then from there we get you signed up. And that when we get you signed up, it's a pretty easy process because we start right from the beginning, so there's not a lot of confusion. There's good material to read through. But the main thing is you're working with that health educator weekly, and you also have midweek support in between that. So if there's any questions or confusion, there's always someone that you can give a phone call to get some clarity there.
All right, great. So, and tell me, whereabouts are you located, and how can folks find you?
We are located, like Bob said, right in the Heart Center, Mercy Health Heart Center. It's on the corner of Sherman and Roberts, kitty corner from the Walgreens there. And yeah, all you do is come in that front door entrance, and right away we have Jennifer, a smiling face, to help answer your questions and lead you to the right spot.
All right. We're going to take a short break and get back to this great discussion about Mercy Health's HMR program. But first, I wanted to remind our listeners about another great program, Mercy Health, free student heart screenings. Mercy Health high school student heart screenings are free and open to any high school student from 9th to 12th grade or entering 9th grade in the fall. Each student must have a parent or a parent's consent to undergo the screening. The screenings take place at our Hackley campus in Muskegon. Heart screenings are simple. A quick method to identifying pre-existing heart conditions that increase a student's risk of complications during physical activity and or athletic competition. Since 2012, Mercy Health has screened a total of 3,500 high school students and diagnosed 4 at-risk students with a serious heart condition, while also identifying over 50% of the students with borderline or high blood pressure. Heart screenings are completed in approximately 15 minutes and consist of a heart history questionnaire, blood pressure check, 12-lead EKG, physician exam, and if necessary, an echocardiogram. For more information on upcoming dates and registration, go to mercyhealthheartandvascular.com. Sign up now for your child's free screening. That's another great program that Mercy Health has. And as we're talking about great programs at Mercy Health, we're here with Carrie Kelly and Bob and Merle Scolnik talking about the HMR program at Mercy Health. And Carrie, this is an award-winning program. This isn't just something that somebody came to you and said, like, hey, we got a weight loss program that you might be interested in. This is a well-established and a award-winning program, is it not?
It is, yeah. We were pretty pleased with that. U.S. News and World Report, when they released their awards for the best diets out there, there's lots of different categories. We won an award for being number 1 in fastest weight loss by U.S. News and World Report, and I believe number 4 in the category of best weight loss overall.
And Bob and Merle Scolnik are here with us as well, and they have been in the program. Bob started it a couple years ago, Merle just last summer. And Bob and Merle, one at a time, if you could tell us, what is the thing that you were most impressed by the program and what it did for you or for your loved one? Bob, go ahead.
Well, it's hard to describe what the feeling when you're successful at something and it just, your whole attitude changes. I mean, all of a sudden, I'm feeling pretty good about myself where, I don't know, when you feel heavy or you are heavy and, I don't know. It's just something about your self-confidence, something about your ability to get things done around the house. If nothing, like I normally my desk is full of a number of projects that need to be done, and when I was heavier, it seemed like it was hard. I had to force myself to get the things, just to start them.
Yeah, the motivation was harder then.
Motivation was harder, and all of a sudden, I'm feeling better. I lost 10 pounds. I lost 20 pounds. Lost 30 pounds. All of a sudden, hey, I'm going to go do the laundry. I'm going to empty the dishwasher. I'm going to go I'm going to go wash the car. I mean, it was like I just felt a whole lot better. I really felt better when I was wearing clothes that fit right. And to be honest with you, I was tired of going to the, even though I love my seamstress, I was tired of going there, having her, and she would occasionally give me clothes back and say, I'm good, but I can't do miracles. You're going to have to buy bigger clothes. So, all that made me feel good. And this, another thing that I started doing, I started tracking, which is something they teach you in the class. I started tracking my food. I was keeping track of how much I was eating. I was writing things down. And I know I do wear a Fitbit, and Merle will get her Fitbit hooked up this afternoon. I'm going to do that for her.
Thank you.
It's not her first Fitbit either. This is the second one. But I know how many calories I burn. So the Fitbit tells you that, or you don't even need a Fitbit. You can figure it out. You know how many calories you're burning depending on the activity. Well, if you're eating 2,500 calories and you're burning 2,000, then you're going to put weight on. If you're eating 1,500 calories and you're burning up 2,500, the weight will slowly melt off. And that's, I mean, the things I learned were great. But anyway, it was really good for me.
Well, now Merle, you got a chance to see your husband firsthand on his venture into this, and then you, of course, after Bob's challenge, joined him. What were your thoughts as you saw this affecting Bob, and then you coming aboard?
Well, Bob looked good. He was feeling good and everything, and I have many issues that as far as health is concerned. And I've always been heavy. I was a heavy child. I was a heavy teenager. And I don't remember ever being on the scale when it wasn't higher than it should have been. And so I'm feeling pretty good about myself now, taking off the weight, knowing that I can do it. And that, to me, is really an accomplishment. I really feel like all of a sudden when my mother was saying diet, 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 I could say, I did it, I did it, I did it, I did it.
All right.
There.
Yeah, great. And Carrie, this is not uncommon story that we hear. And I really appreciate Bob and Merle coming in and talking about their personal stories. But it's not an unusual story of success for you folks at the HMR program.
Yeah, definitely. I must say all of us back at the office, we've been really impressed with the Scolniks because they do have a very social lifestyle. And so that's definitely one of the things where we knew that could be a challenge for them. But they have handled it very well because in the end, we want everyone to learn that it is all about moderation. So we don't expect everyone to be drinking shakes and eating entrees forever. You can always use them, where it's necessary, but we want you to go and have fun at, the birthday parties and at the weddings and those kinds of things. But, those splurges shouldn't be like your normal lifestyle. So, and I think Merle and Bob are both true testaments of that. They go out and they have their fun, but then they get back on track and they, get their walking in and they drink their shakes when it works for them and have their entrees when it's convenient. And, Merle's sitting here with her water bottle right now. So it really is about lifestyle change forever. What are the small changes that are healthy that you can incorporate into your life so that you can keep it manageable and make sure that you do it for the long haul.
And as we talked in the first part of today's segment, it's really critical that you talk through the program and you folks listen to the people that come to you and sort of learn what their challenges are, and then from there build up a program and an understanding of what they should do. Take us through. Now you've joined the program and you're through the first phase. What's the follow-up phase for this?
Yeah, so that's a great question. So there's phase 1 is weight loss, and that's where we want to help you get as close to your weight loss goal as you can. And then phase 2, that's where we're helping you learn how to maintain your weight loss. So you still are having some meal replacements where appropriate, but we're really just making sure that you're staying accountability to your new lifestyle. So you're focusing on fruits and vegetables. You're still coming to classes each week. You just have that support as you get off of the structured plan and get out, into the real world where some dangerously high-calorie foods are lurking there for you. But that can be mastered too. And then after that, there's phase 3, where we back down on your attendance so that you're just checking in with us like once a month where it's necessary. And it's crazy to me to know that sometimes just checking in with somebody once a month can keep the person on track. So if there's something that happens and they get off track, there's always your little cheerleader back here at the office just waiting to help you get, find your way back.
And speaking of cheerleaders for the program, we have a couple right here, in Bob and Merle Scolnik. And Merle and Bob, I'm going to ask you both this question. So if there's somebody out there that is struggling with weight gain and like Bob said earlier, is just not feeling good about themselves, Merle, let me ask you first. What advice would you give to somebody out there and tell them why they should look at HMR?
Well, I think it's an easy program to follow, and the staff is just really wonderful. You walk in and everybody has a smile and everybody's cheery and they make you feel good, and that's important too. And then the food is, there's some I don't like, there's some that are a little spicy, but for the most part, I'm really happy with the program and what it does and the food that I eat.
How about you, Bob? You've been in a little bit longer, but what would you tell folks, anybody that is listening in and is saying, I kind of feel like Bob. I don't like the way my clothes fit, or I just don't like how I'm feeling about myself right now. What would you say to them?
Well, here's having gone to a lot of classes, there are all kinds of people there. There's young people, there's older people, there are people there that are very overweight, and that I've seen people in that program lose over 100 pounds and more, and others that just needed to take off maybe 20 pounds. But here's something that, from my standpoint, it has to do with our age. As you get older, it's harder to do some of these things because maybe your metabolism slows down. You're just not physically able to do some of the things you could do. I can tell you that Merle is, she doesn't think I pay attention, but I do. She can't exercise the way a lot of people can just because of her arthritis and some of the physical constraints that she has. But the weight has been coming off because she has done what she can do. And the food, I've just watched, she's just does it. She's careful what she eats. She eats the entrees. She eats the things that they tell her to eat. I know when we go out to eat, it's sort of making me feel guilty because she eats less than she used to. And I think it's because she's so conscious of trying to stay on this diet. And I know that she gets weighed in on Thursday, so come Wednesday, look out. We're not eating. We're being really careful what we eat. Last night we went to an event. Really, there was food there, but we really didn't eat there, so we came home and she wanted to stop. She had gotten weighed in. We stopped at Pizza Hut. We did have a pizza, but she didn't eat very much of it. And she wanted a real thin crust one. And to be honest with you, it didn't taste that good, but it was like healthy. It's made a big difference in our lives, and it's a diet that anybody can do. And here's one little thing. I'm just going to add this, and I'll be done. Any of these diets are going to cost some money. It is going to cost some money, but it really didn't cost us very much, if anything at all, because we were eating the entrees, the shakes. We weren't buying groceries.
Right. That was really a replacement for your money you were spending on groceries anyhow.
That's why they call them meal replacements, really, I think.
Mm-hmm. Right.
So, to me, the cost was pretty much neutral.
Great. Well, that's some really, really great information about the program. And, Carrie, if you could sort of take this home for us. Once again, what is the HMR program, and where do we find it, and where do we find more information about it?
Sure. So if you need accountability and structure to help you get started on your weight loss journey, we are more than happy to have you give us a call so we can start you with that. We are located in the Mercy Health Heart Center on the corner of Sherman and Roberts, and you can give us a call at 231-672-4325.
And who should consider HMR, and why should you consider HMR? There's proven results. It's data driven. It's physician backed, and we've served many people since 1990 and helped them reach their goals. And if you have a weight loss problem, we can probably help you. And Bob and Merle Scolnik will tell you that it's a very good program. They've been here this afternoon helping us and sharing with us their personal story. We want to thank them for sharing their personal story about the HMR program. Any last words, Carrie, on the HMR program? We hope to be hearing from you soon. Right. Yeah, and go to Mercy Health website, and you can find the HMR program there. And there's a lot of other information about the resources that they have in the program and how to join the program and the certain phases of the program. So we want to thank our guests today, Carrie Kelly, and Operations Supervisor of Mercy Health's Weight Management, and Merle and Bob Scolnik. Thanks so much for being here today with us. It was a great sharing of that story. Today's broadcast has been brought to you by Mercy Health Muskegon. Please join us next week when we discuss the differences between Mercy Health's primary care, urgent care, and emergency care. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.